Hello, today we'll be taking this subject's blood pressure. First, it's important to check that both feet are flat on the ground. Second, subject should be seated quietly for at least 5 minutes on a chair with back support. I will be administering the subject's blood pressure on the left arm, palm facing upward, along the brachial artery and the location of the stethoscope. Subject's arm sleeve must be rolled up for the placement of the blood pressure cuff. First, subject should refrain from smoking cigarettes. Second, no ingestion of caffeine. Third, no physical activity within 30 minutes. Appropriate cuff size must be used to ensure accurate measure on the bladder of the cuff. The index on the cuff is below the range of measurement, which is not acceptable. Now the index on the cuff is now above the range of measurement, which is also unacceptable. The index must be placed in between as indicated on the bladder. The bladder within the cuff should encircle at least 80% of the upper arm. Many adults require a large adult cuff. My finger points to the brachial artery on the cuff, which must be aligned to the subject's brachial artery. The cuff must be wrapped around the subject's arm firmly and still aligned with the brachial artery. When using the stethoscope, be sure that the earbuds are facing forward as angled and not towards you. Place the earbuds securely in your ear. Lightly tap on the stethoscope to ensure that it is working properly. Using your middle and index finger, locate the subject's brachial artery. Place the bell of the stethoscope on the brachial artery, and that your fingers support the base of the bell. To inflate the cuff, twist the knob clockwise to ensure the air is secure. Now pump air into the cuff until the dial reads 200 millimeters of mercury. Once the dial has reached 200 millimeters of mercury, slowly release the pressure at a rate of 2 to 5 millimeters of mercury by twisting the knob counterclockwise. When you hear the first thump, note the needle's position and record the systolic pressure. When you hear the last thump, note the needle's position and record the diastolic pressure. When there is no longer a thump, completely release the air by turning the knob counterclockwise. At least 2 measurements should be taken with a minimum of 1 minute apart, and the average of those 2 must be taken as well. Provide to patients verbally and in writing the specific blood pressure numbers and blood pressure goals. This table is a classification of blood pressure for adults. Normal systolic blood pressure is below 120. Diastolic blood pressure is below 80. For pre-hypertension, systolic blood pressure is 120-139. Diastolic blood pressure 80 to 89. Stage 1 hypertension, systolic blood pressure is 140-159. Diastolic blood pressure is 90 to 99. Stage 2 hypertension is greater than 160 systolic blood pressure, and diastolic blood pressure is greater than 100.